Hi, welcome back to Student Nurse Success, where we're wrapping up our series on renal disorders. In this video, we're going to cover acute and chronic renal failure. Both of these are often consequences of any of the renal disorders that we've covered in the prior videos. Remember, you can find the link to the maps in the comments section. Let's go ahead and get started. I'd like to begin with acute renal failure. Acute renal failure is often referred to as ARF or even AKI. AKI stands for acute kidney injury. Usually, the most common reason for acute renal failure is due to a sudden reduction of blood flow to the kidneys, causing ischemia. We know this to be a pre-renal cause. When we have decreased blood flow to the kidneys itself, that's often going to cause acute renal failure or cause the kidneys to shut down and not work for a period of time. We also know that intrarenal damage or intrarenal disorders can also lead to acute renal failure. And postrenal obstruction, if it's severe enough and the backup of urine into the kidneys is enough that it causes hydronephrosis, that can also cause acute renal failure as well. The thing about acute renal failure is that it is potentially reversible. And actually, in a lot of cases, your kidneys will quit working for a period of time. It could be hours, it could be days, it could even be maybe several weeks. But in a lot of cases of acute renal failure, your kidneys will actually start functioning again. So, acute renal failure can develop within hours to even days, and we see it pretty commonly in those in the ICU. About a quarter of our ICU patients experience acute renal failure. When we have acute renal failure, especially if it's from ischemia or lack of blood flow through the kidneys, we start to see necrosis of the tubules, also known as acute tubular necrosis or ATN. And this necrosis or damage to the tubules causes the kidneys to not filter and function well at all. I would say probably one of the biggest causes of acute renal failure from prerenal causes is myocardial infarction or a severe decrease in cardiac output, maybe from a severe trauma or hypovolemia. When we talk about acute renal failure, there's a couple phases that we move through. The onset of acute renal failure is the time from the causing event, maybe the MI or the decrease in blood flow, until the time of tubular injury. The next phase we move into is what's called the oliguric phase. In the oliguric phase, we see a decrease in urine output. Because of that decrease in urine output, we see an increase in our blood pressure. Patients become fluid volume overloaded and edematous because they're not putting urine out. We see potassium levels start to rise. We see the development of metabolic acidosis, and we see a drop in filtration rate. We will probably also see an increase in their urine creatinine levels. Now, patients will remain in this oliguric phase. We can provide them with supportive care. We may even have to do some dialysis, and their kidneys may recover. If they do recover, they will move into what we call the diuretic phase. In the diuretic phase, we start to see the urine output increase and the electrolytes will start to stabilize. So we actually start to see an increase in this urine output. Now, not all patients will recover. And if they aren't able to move into this diuretic recovery phase, then they're going to move into chronic renal failure. And we'll talk about that in just a moment. I'd like to talk a little bit more about this oliguric phase and these complications. I'd like to talk a little bit more about the manifestations and complications of acute renal failure, specifically during the oliguric phase. During the oliguric phase, patients will develop what is called uremic syndrome. Again, whenever we're talking about a syndrome, we're talking about the collection of symptoms. Uremic syndrome is really a group of symptoms that show you that your kidneys are not filtering and functioning well. We see the development of azotemia, which is a buildup of nitrogen and waste in the bloodstream. Patients may become itchy and not feel good because of this buildup of waste. We see a decrease in their vitamin D levels, which results in a decrease in their calcium levels. Remember, your kidneys are responsible for the conversion to vitamin D, and vitamin D is necessary for the absorption of calcium. Because your kidneys are primarily responsible for getting rid of potassium, if they're not functioning, your potassium levels will rise. Same with your phosphorus levels, your sodium levels as well. Patients will start to develop metabolic acidosis, and in fact, the biggest cause of metabolic acidosis is renal failure. Patients will also develop anemia because of the decrease in making of erythropoietin, which is necessary to produce red blood cells, and their output of urine will be decreased. With all of these symptoms of uremic syndrome, it's not uncommon for patients to feel fatigued, malaise, to be fluid volume overloaded. Perhaps we'll see their blood pressure go up along with lung congestion and edema. And we may have some altered mental status from the increase in waste and nitrogen from the azotemia. While patients are in acute renal failure, we can do dialysis supportively. We can do dialysis to kind of clear out some of these toxins, to get those electrolytes in level, and to clear out some extra fluids. And we may only need to do a few dialysis treatments, and their kidneys may start to function again, and then they move into the diuretic phase. But in some individuals, they may not move out of acute renal failure, and they may move into chronic renal failure. Chronic renal failure cause is usually from another disease process, maybe an intrarenal disorder, maybe polycystic kidney disease or glomerular nephritis or nephrotic syndrome that did not resolve, or chronic renal failure can be from acute renal failure that does not resolve. We also know that patients with diabetes and high blood pressure most often develop chronic renal failure as part of their comorbidities. So, diabetes and hypertension are probably the biggest risk factors for develop chronic renal failure. Chronic renal failure is different from acute renal failure because it is not reversible. Chronic renal failure is progressive. What we see in chronic renal failure is the progressive loss of nephrons or filtration. What happens is, as we lose nephrons, the nephrons that are remaining have to do even more work. And so it's harder on them, and then they die off. So what we see is this chronic loss or progressive loss of nephrons, and really just this slow chronic process of kidney failure. In chronic renal failure, there's usually 5 stages. In stages 1 through 3, patients move through worse and worse filtration rates, and so their GFR starts to actually decrease in each of these stages. In stages 1 through 3, the patient is still getting some urine function. So their kidneys are still working. They do not need dialysis. However, because we're really trying to protect those few nephrons that are left doing all this heavy work, we have very strict diet control of protein, water, and electrolytes. So we're really focused on protection of those nephrons and making the work easier for them. Once a patient moves into stage 4 or 5, when their filtration rate is pretty low, then they need dialysis or a transplant because their kidneys are not filtering enough at all. Complications or manifestations of chronic renal failure include uremic syndrome, and I'd like you to go ahead and remember all of those. Look up here. These are important. Patients will develop high blood pressure and increase their risk of cardiovascular disease. As renal failure progresses, their cardiovascular disease risk factors also increase because it accelerates the atherosclerotic process. Because the kidneys are not working well, they're not making enough erythropoietin, we see anemia, we see malnutrition from the severe dietary restrictions necessary for chronic renal failure, and we may see some bone mineral diseases from a decrease in the vitamin D and calcium levels. Often, it's not uncommon to see generalized pain and depression in individuals who are in chronic renal failure. Let's talk about treatment and goals. The goal of treatment of acute renal failure is mostly supportive, and we're really just hoping that that kidney function returns. So we're going to do maybe some short-term dialysis and really supportive care, hoping those kidneys start to turn back on and work again. With chronic renal failure, really the goal is to delay or slow the progression through the stages as much as possible. In both cases, eventually patients may not have any kidney function or they may need dialysis. There are two types of dialysis, peritoneal dialysis and hemodialysis. In peritoneal dialysis, patients actually instill a diacylate fluid. And this fluid is specially formulated. It's high in certain content. And what we do is they actually have a catheter access in their abdominal area, and they actually instill the fluid into their peritoneum and actually leave it in their peritoneum for several hours. During that time, the fluids and electrolytes are exchanged from the bloodstream into this fluid. Waste diffuse into this fluid, and then the patient will rehook up their catheter and actually open up the valve and drain this fluid out of their peritoneum. The benefits of peritoneal dialysis is you can do it at home. You can do it while you work. You can do it at night while you sleep. It can be done at home, and it's much more convenient for patients. However, there is risk of peritonitis or infection into the peritoneum. Hemodialysis is when blood is pulled out of the body and run through an actual machine or filter. This cannot be done at home as easily. What we see with this is the need for an AV fistula or some type of cannulation access to the bloodstream. With hemodialysis, there's more risk of hemodynamic instability because you're pulling blood out of the body, and we also have an increased risk of bloodstream infection. And there you have it, a nice summary of acute and chronic renal failure and the differences between the two. Remember to subscribe and like our videos so that you keep up to date on all the new ones that we are putting up. Thanks and have a great day.